Good morning, everybody. My name is Matt Constantine, Kern County Director of Public Health. We're joined for the first time with an ASL interpreter, Stephanie Smart, from the Independent Living Center. So we're honored to have her here with us this morning. Late yesterday evening and around midnight this morning, we received notification that 2 Kern County residents tested positive for COVID-19. This marks the first 2 cases of COVID-19 in Kern County residents. Both of these residents are recuperating at home. We are currently investigating these 2 cases to determine if there were, what their potential exposure sources were, and if they themselves have exposed any household or close contacts. With these 2 identified cases, it's a good reminder for our community to continue their efforts and their diligence to practice good hygiene and stay home when you're sick. And as you know, these measures will dramatically reduce your risk of exposure and reduce the chances that you may impact others. As an overview, in the U.S., as of March 18th at 4 p.m., there's 7,038 cases with 97 deaths, and now we have affected all 50 states. In California, we have 598 cases with 13 deaths. In Kern County, as of March 18th at 3 p.m., we have 123 tests that are pending and now have 76 tests that are negative. As we mention each time, our monitoring program, there are 30 returning travelers that we have had or are in the program. 22 have either not needed to continue their program or have completed it. We received notification from the California Department of Public Health yesterday, though, that they will not be sending us any new traveler information. CDPH, the state public health department, has indicated that community spread from returning travelers has proportionately diminished due to the amount of community transmission that exists in the state now. So the number that we will be reporting on will never exceed 30, and as those transfer through the period, those numbers will then diminish. We've also stood up a website that's behind me that is going to provide real-time data so that you have access to the numbers. You'll notice that the positive detected is still at 0. That will go to 2 as we leave here today. This will be updated routinely so you have the most current information. And I want to again reiterate that the county and our incorporated cities and our first responders and our healthcare professionals are prepared. We have practice for events similar to this, similar to events that stress our infrastructure, that place an increased demand on our services, and we have set aside both medical and health-related supplies for events just like this. And finally, I want to mention again that this is our time when we need to ensure our families are safe, our friends are safe, and that we reach out to our community members. You have individuals in our community that perhaps have a compromised immune system or that are older. It's our obligation to look out for them and to knock on the door and to help. That concludes my formal comments, and I'm happy to take any questions you may have.
Are these 2 new cases connected to the previous case that we were monitoring before?
So what I will report this morning as these are 2 new Kern County residents that have tested positive.
And no need for community to be worried about their goings on during this whole process?
So we are currently investigating where they potentially were exposed and if there was anybody that they may have exposed. That is our investigation that we're doing actually as we speak.
Can you confirm which cities in Kern County these two residents are from?
So what we will confirm is that they are Kern County residents, but no further than that.
Is there a reason why we aren't able to disclose
Sure.
which cities that they're
Sure.
from locally?
So we want to ensure that we protect the health information and the individual themselves, and we take that seriously. Not only because it's legally prohibited for me to release, but ethically, that is not something that we want to do.
Are these two separate households?
These are two separate residents.
What about the age? I mean, other news stations across the country have been at least giving a range, so that's less identifying in lines with the HIPAA laws. So can you at least give us an age range between 30 and 40? You know, especially since there's been new reports that the younger age groups are starting to become an issue. So if you could give light on just what we're experiencing right here in Kern County in a sense of just a range so that it will protect patient information as well as inform the public.
Sure, I understand the question. And as you're aware, as we've watched the transmission of the disease through the United States and through the world, we have seen disproportionately that those that are older suffer greater consequences, especially in the United States. We've watched that carefully. And previously, we've noticed that children aren't as affected. We have seen some numbers worldwide that may change slightly, but as it stands today, what I'm releasing to you is there's two Kern County residents that have tested positive. We're not going to release any more information about those individuals.
These 30 return travelers,
Yes, ma'am.
are you able to confirm, are these mostly international travelers or domestic travelers that you've been monitoring?
Right, so under the CDC program, anybody that returned from China or Iran were screened by the CDC at one of those 11 airports. And if they met certain criteria, then the CDC sent that information to the state, and the state sent it to us for those that we should assess and, if appropriate, monitor.
So piggybacking off of that question, can you tell us right now if these are travel-related cases?
I cannot.
So to confirm, those 30 cases, they're just from China and Iran. Would that be accurate to say?
Yes, that's correct.
So what would have to happen? What would have to happen to require us to be in a shelter-in-place scenario?
So our interest today is to do everything we can to protect our residents. We've been trying to provide information that is helpful to the residents of Kern County. That's why we're sharing all the data for you. The actions that the governor has taken and that the guidance documents from the state have been helpful into limiting potential exposure and to limiting the impacts to others for those that are sick. And I believe those actions are going to be helpful. As you've noticed in our community, people are listening to them and they're taking that seriously, and that message has been received. As we watch nationwide to see how COVID-19 is spread through the United States and how it affects different communities, I think every community is making up their own decisions on how best to protect. And we've seen in California, different cities and counties have taken different actions. As we stand today, this is evolving. We now have our first cases, and we need to evaluate potential risks and take those actions necessary to protect. Beyond the actions that the governor has listed and the guidance documents, at this point, we're not recommending any further action.
Is the risk of transmission still low now that we have 2 residents?
So again, this is changing. We're still investigating these 2 cases. We need to understand more, but I believe that with information that we will learn, that community transmission may be likely now that we've seen these cases. We still have some more research to do, but these 2 cases show that the disease is here and that the potential for community-wide spread may exist.
And you said those travelers, they're from Iran and China. How about Italy? Are any of those travelers being monitored?
So initially, a few days ago, the state indicated that, and the CDC indicated that European travelers were also going to be included from certain communities, certain locations. And we were told Tier 3 countries would be included. With the change now in the state's action, because of the spread within the state, we will not receive those names. Other states may take different action based on the presence or absence of COVID-19 in those communities.
At what time did you learn about the two cases, and are they interconnected?
So we learned about the first case in the late evening, and the second case...
Last night.
Yes, sir, last night, and the second case around midnight this morning.
Is it correct?
And well, also, are they connected? Are they interconnected with each other?
So these are two residents that tested positive. We don't believe there's any connection, but we still don't know. We're still doing our investigation.
Matt, you said 123 pending tests, but it says 192. Is
So-
that more?
So let's check
recent
our numbers. And my numbers could be outdated because this is changing quickly. So I will ask for clarification, but I show 123 and that shows 192. So I'll get you clarification.
Is there a designated time you guys gonna make sure you guys update?
Notices that 10 and 4, this is updated. So I don't. Michelle, do you have updates?
Your current, this is going to be updated very soon.
So the 123 is correct. The 196 is not.
Correct.
Okay. So
193 pending?
192?
Michelle,
What, do we know what that one?
I show 123 pending results and 76 are negative.
And that's from our, so that is correct.
My numbers are correct.
Yeah.
We just turned this on before we came down.
Do you plan to announce after you start investigating, like, these people went to this restaurant or to the mall or wherever, will you be announcing that to the public?
If that information is relevant, if we are concerned that somebody that was positive potentially exposed the public, then yes, we will release information because that is relevant to the community about potential exposure. If it is limited to individuals, we will make individual contact with them.
Does the county and city need to change or make any action now that we have these two cases?
This is too early to make that determination. I think those are discussions that should happen as we track the disease progression in the county. But as it stands today, no.
Are you surprised that we have two, I mean, we have 3 cases currently, right? Because that other person is still.
So as it's defined by law, we have 2 cases and a visitor, so yes.
Okay. So are you surprised by the 3 cases? Do you have any estimates on projections on how many more we might see? Is that something you guys talk about?
So we're not surprised. We've been watching carefully how the disease has progressed through different communities. As we've stated multiple times, we don't believe we're immune, that this would affect us also. We do not have any specialized modeling that the general public doesn't have access to. It looks like the numbers are changing again as we speak. So we've seen estimates. We've been trying to run those numbers too in general, but I don't have any more specific than what's been promoted online.
Thanks. I was at the testing site at Accelerated Urgent Care yesterday, and people have many questions. A lot of them were about whether or not there are free tests out there, because if they didn't have insurance, it was
Sure.
$25. Is there a way to get a free test?
Sure. So the answer that I'm aware of is some healthcare providers have eliminated some of the cost, right? Some of the deductibles. We've heard of some waiving the cost. I'm not certain about free tests. We have a group that is evaluating where testing is being done. Is there shortages of supplies? So we can certainly evaluate and look for options for reduced or free costs for testing.
Is there a concern about shortage of tests because that's happening elsewhere?
So we're tracking this really closely. We have a lot of local providers that have a supply, and they're doing a lot of testing. They're doing drive-through testing. We have the hospitals that are doing testing. We at times have seen shortages due to contractual arrangements that they've had to find a different lab. We have heard statewide there are at times shortages of either the swabs that they need or the preservatives or even the laboratory equipment that's needed, but that seems to change quite often. As it stands now, we're not aware of a sustained shortage in Kern.
Do you know how many tests we have available here? Is that a number you guys track?
So as it is now, the doctor, your doctor, is able to make that determination if you should be tested, and then they use their contracted lab to do it. So every time a doctor believes that there is a suspected case, they are required to immediately notify public health. That's in law. Once those test results come back, then that's also reportable to us. We have seen at times that the doctors are not telling us about those tests that they are running. We have regular communication with them, so we've included that in communication yesterday that said, please ensure that you're notifying public health of any suspected case that you're testing. So I don't have, beyond what is being publicly discussed, the 123 tests that are pending, I have no further information.
Are people safe to go to parks and do things outside and exercise outdoors, things like that?
Yes, they are. We need to think about the guidance that has come down from the state about ensuring that we are not in larger gatherings and to figure out ways to stay away from people that are sick and stay home if you're sick. But other than that, yes, we believe that that is still the best course of action. It's nice to get out, especially this time of year, go on a walk or a jog. That is appropriate.
Are there any precautions that people should take considering that, at least for me, this has been a question, this is droplets that would need to dissipate to the ground in light of gravity. So if someone was to walk through the hallway after someone was to sneeze, who was infected potentially,
Sure.
could that be a risk if you're just out in your daily life? I think that that's like some overbearing concern that some
Sure.
people may have. So if we can just clarify that a
Sure.
little bit, like that going to the park or walking
Sure.
outside where someone just sneezes isn't an issue.
Sure. So the science shows that you need sustained close contact with somebody that is infectious and symptomatic. That generally doesn't happen in incidental or very short, brief interactions. We've talked about the 6-foot separation that dramatically reduces. In addition, even if you're within that 6-foot zone, it takes some time for that transmission to occur. Is it possible that transmission could occur in the situation that you've stated? Yes, but it is unlikely. We also have Ellie here that will be able to take any questions in Spanish, and if that's of help too. Yes, sir. Any other questions?
You said this will update at 4 o'clock?
At 10 and 4 every day. So yes, it should be up to date on those, and it notes that on the website. We'll clarify the testing for you too, as we want to make sure that's really clear for you.
Well, actually,
Okay.
Michelle did just say that
Did she?
this is the most current.
Oh, we've changed direction.
While you were talking,
They
literally
updated. Gotcha. So that's part of the real-time update issue that we faced, that as I left upstairs and we reviewed, it was 123, so it changed. Okay, thank you for coming. Yep, sure.
You are listening to remarks from the Director of Public Health, Matt Constantine, up there confirming that there are now 2 confirmed tests, 2 confirmed patients that have the COVID-19 coronavirus here in Kern County. The number of tests that are pending, as Matt Constantine was referring to just a moment ago, seems to be fluctuating with every minute. Saying early on in the press conference, if you're just joining us, that 123 tests are pending, 76 of them negative, but now we do have 2 positive. And we also heard that the 2 positive cases are in separate residents, that they learned about the first case late last night and that the second case was announced this morning. Now, they don't believe, they said at this point, that there is a connection between these two cases, but that is one of several things that they are currently investigating. Matt Constantine also said during his press conference they're trying to trace where these individuals may have visited, whether it was around town or Kern County, before showing any of these symptoms, and only said that his office would release that information on where the patients may have visited if it's vital to public safety, raising concern about other possible infection. Now that mass testing is underway, they've said they expect many more confirmed cases to start popping up within the community. Until yesterday, if you remember, there were 0 local cases, just the one out-of-town resident who had tested positive for COVID-19 and was self-isolating at a home in Kern County with 5 other people that were termed as contacts. Once again, Kern County has its first 2 official cases of COVID-19. We understand from Matt Constantine that they are self-isolating at this time. We do know that Accelerated Urgent Care is one of several facilities that are now testing people in mass and have set up to do so. We're going to continue to follow this story. Let's go back. I believe he's taking more questions now. It looked like it was wrapping up, and let's listen in again if we could.
Because that again infringes on their medical rights, and we don't want to identify the individual. So I don't think it's appropriate for us to provide any information. Okay, thank you very much for coming.
All right, once again, we want to thank you for tuning in to 23 ABC's live coverage of this announcement. Once again, if you're just joining us, 2 confirmed cases now of local residents that have contracted the COVID-19 virus. At this time, they are self-isolating. He just did, while we were out, confirm that with our reporter Tori Cooper, who is inside the facility right now. We'll have more on this coming up at the top of the hour in just about 35 minutes for 23 ABC News at 11 a.m. You, of course, can watch this in its entirety again on our 23 ABC Facebook page and, of course, across our social media platforms. We'll be back in about 30 minutes at the top of the hour with more on this announcement. I'm Mike Hart. Thanks for tuning in.